Okay, so the next step, now that we know about equity and how to that we can actually reduce inequities through certain interventions, we thought we'd explain how you might report equity in the systematic review. So just as a reminder, PRISMA is the preferred reporting items for systematic reviews and meta-analyses, and it's the reporting guideline that all systematic reviews should use to promote the transparency of the reporting of their methods and results. And over 200 journals endorse PRISMA. So if you've worked on a systematic review, you've probably worked on a PRISMA checklist and a PRISMA flow diagram. We consider an equity-focused systematic review one that assesses the effects of the intervention targeted at disadvantaged or at-risk population. So these might not actually include equity as an outcome, but because they've targeted a disadvantaged population, they're likely to have some effect on inequity or provide some evidence about reducing inequities. And the second is a systematic review that assesses the effects of interventions that are aimed at reducing the social gradient across populations or that provide evidence about the effect of the intervention among some groups of the population. So, for example, there's a review about interventions to reduce the social gradient in smoking. But this category would also include systematic reviews that don't actually have any aim at reducing inequities, but where there'd likely be important equity effects. So, for example, there's a review about interventions that are delivered by lay health workers, and so that review provides evidence about reducing inequities related to access to care.
Great, by Simon Lewin, fantastic review. Just everyone looks at it.
Okay, so in 2012, we worked on an equity extension of the PRISMA statement. So extending PRISMA to include additional items that would be important if you were reporting an equity-focused systematic review. And the idea is, or the goal is, that this will help provide clear guidance on reporting equity-focused systematic reviews, and that would enhance the reporting of results in systematic reviews around health equity. So the paper was published in 2012 that includes the checklist, but in 2015 we published an explanation and elaboration document that provides actual examples of good reporting from published systematic reviews. So you can find that as well.
In PLOS Medicine.
Yes. And JCE and
okay.
JDAP. So we won't go through each reporting. This just to show you an example of what the checklist looks like. So if you've seen other PRISMA extensions, it's quite similar, but on the right-hand side are the extension items specifically for equity-focused systematic reviews, and to the left is the standard PRISMA reporting item. So for example, the standard item for PRISMA is to report the study as a systematic review, and for equity, we've recommended saying that equity is using the term equity in the title, just to help people who are looking for equity evidence identify your systematic review when they search. And so basically there are 10 steps in the systematic review process where we think health equity could be considered. So the first is defining the conceptual approach to health equity. The second is to develop a theory-based approach, so a logic model or an analytic framework that includes health equity as an outcome or shows how health equity might be important along the causal chain or the mechanism of action of the intervention. The third is to think about equity in your question, so about equity in your when you're defining your population for your systematic review, but also in the context. The fourth step would be to include relevant study designs to assess equity questions. So you might need to include additional study designs in order to capture some of the evidence about health equity.
So the concept there is fit for purpose, and so we're a little uncomfortable about pushing the pyramid that's in all of the basic evidence-based texts because depending on the question, and John Lavis has written some wonderful work on this. If you're looking at the size of the impact, clearly you want to look at it experimental. But in fact, if you want to look at how it works, then we strongly encourage qualitative research.
The next step would be identifying information sources for equity questions. So if you're conducting an equity-focused systematic review, you may need to consider additional databases to ensure that you capture research that's looked at your equity question. The next step is defining search terms for health equity questions. So there's no validated health equity filter that you can apply to your search strategy, but there could be some additional search terms that you might need to include to help identify evidence related to your question. The next step is developing data extraction tools for health equity. So we recommend thinking about progress in your data extraction table so that you might be able to extract data related to the population characteristics of interest that would be important for examining the effectiveness of the intervention that you're looking at. The next step is to consider the influence of context and processes on the equity questions. So you might consider conducting a process evaluation about how the intervention is actually working and is it reaching the populations that you're interested in. The next step is to use synthesis approaches to assess equity. So that might be a subgroup analysis, but there could be additional analyses that you'd conduct in order to assess the impact on health equity. And then the last step is to collect data related to the applicability of the equity questions. So you might not actually have any evidence to address your equity question, and so you might have to make some judgments about whether that evidence is applicable to the population of interest that you were examining.